When people began applying for health insurance under the Affordable Care Act a year ago, many working poor found out they didn't qualify. At the Morton Health Clinic in Tulsa, only about 50 people qualified on a day when 300 were seeking assistance. They made too little money. At the same time, the state rejected federal money to expand Medicaid to take care of them. Today, more than 55% of the clients Morton sees have no insurance, and as of January 1st, it started turning away new patients. John Silva is the Chief Executive Officer for Morton Comprehensive Health Services.
Probably turned away about 60 new patients, which doesn't seem like a lot. That's 10, 12, 15 a week. But you multiply that over a year, that's a lot of folks. So it's very sad.
Silva says until its uninsured pool reaches 45%, Morton will continue its no new client policy.
Until we can do that, we can't risk the organization or the 22,000 patients that we currently have enrolled in our organization. I mean, it's a horrible decision. You want to talk about a no-win.
Morton considers itself a safety net provider, but Silva says the state is not giving Morton the money needed to fully operate. When federal money runs out, the state provides extra operating money through what is called the Uncompensated Care Fund.
To fully fund an uncompensated care pool in this state every year is about $10 million. Right now, the state has appropriated $2.2 million, down from last year. Last year was 3.4.
Well, the reason it was reduced is because, as you know, we had a little bit of a budget shortfall last year, and in order to keep the budget flat, we had to kind of rob Peter to pay Paul.
State Representative Doug Cox, who is also an emergency room physician, says it's going to be tough to restore money to the Uncompensated Care Fund.
The hard truth is I have great concerns that the budget picture is not going to be any better this year. With oil and gas prices what they are, and that's still a major source of our state revenue. And we're kind of catch-22 here. The economy grew enough to trigger the income tax cut, and income tax is another major source of state funds. And then right after it grew, triggered that cut, then gas and oil prices have plummeted.
Cox says the healthcare system is at a crisis point, especially in rural Oklahoma, where many hospitals are operating in the red. In the town of Prague, for example, some wonder if where you live determines if you will live. The Prague Community Hospital is small and not equipped to handle major operations, but those in emergency, life-threatening conditions can be stabilized here long enough to get them transported to Oklahoma City or Tulsa, greatly increasing their chances of survival. Hospital CEO Bill Holland says, like all rural hospitals, Prague doesn't know whether it can afford to continue to operate.
What's going to happen nationally, last year 47 rural hospitals closed, and there's 283 right now on the brink of closure right now.
Holland says big hospitals can absorb losses with revenue from a larger pool of insured patients, but rural hospitals can't survive without the expansion of Medicaid dollars.
So basically we went from that 1% margin of being reimbursed at 101% to 99%. So basically we're getting reimbursed below even our cost.
Holland says closures of rural hospitals have a rippling effect on a town's whole economy, from local pharmacies to employment. Prague Community Hospital employs 65 people.
Our payroll annually is about $2.7 million a year. That's a lot of money, and it's all goes back into Prague.
Cox doesn't foresee Oklahoma changing its stance on accepting federal Medicaid dollars.
I don't think the political will is here to undo that. As a physician, it certainly makes sense to accept that money because that money is being delved out. It's not like it's free money. That was financed by a 2% reduction in Medicare payments to physicians and hospitals. Other states are getting that money, but the reality of it is the political will is not here to accept that.
Those involved in the conversation say as more and more people flood into emergency rooms, costs to insured will continue to increase.